Hello, and welcome to Genesis Spirit of Women's Cancer Program, We'll Fight With You. Tonight's program is designed to help you learn information about potential signs of cancer and also a new lung cancer detection technology available at Genesis. We also have a demonstration with Dale Houston and the Martial Arts School of Ki. Be sure to add your name in the comment section to let us know you're watching during the live event. When the program ends, we will draw names to win door prizes from our Spirit of Women business partners. We'll announce the winners in a separate post following the live event, and we'll contact the winners via Facebook Messenger. Tonight, we're giving away a $50 gift certificate for Pampered Chef from Audra and a $50 value punch card for dance classes at Movement on Main Dance Studio. Also, we have a beautiful gift basket from Northside Pharmacy valued at over $50. Let's get started. I'd like to introduce to you Pebbles Thornton, the Genesis Director of Cancer Services. Welcome, Pebbles.
Hello, and welcome to the program. When it comes to cancer, the Genesis Cancer Care team is with you to fight for cancer prevention, diagnosis, and treatment. We're excited to share with you information about how we're going to help you with this fight. And we'll start with one of our radiation oncologists, Dr. Shalini Gupta. Dr. Gupta is one of our board-certified radiation oncologists. She started with Genesis 7 years ago and is originally from Ohio. In the time she has been at Genesis, we opened a new cancer care center almost 6 years ago with the latest technology to provide excellent cancer care to our community. Welcome to the program, Dr. Gupta. In honor of October being Breast Cancer Awareness Month, can you please tell us about early detection and prevention of breast cancer?
Thank you, Pebbles. Yes, I'd like to take this opportunity to talk about self-breast exams. That's one of the most important tools that you as a patient can do at home. I recommend doing it once per month, about the same time every month. For women who are still having their menstrual cycles, I suggest doing it at the end of your period. And you want to not only feel your breast to see if you notice any changes from month to month, and it's important to use both lighter and deeper pressure when feeling for any lumps or bumps, but also visually look at the skin and the nipple area and see if you notice any changes, and definitely alert your primary care doctor right away if you do. Another important tool in addition to the self-breast exams that you can do at home is to come in for a screening mammogram. That is an imaging study that will help us pick up any lumps or abnormalities in your breast that are possibly too small for you to feel on your own. Different organizations have different recommendations for when and how often to screen, but my recommendation is to follow the same guideline as one of our national cancer organizations, and that is starting at age 40 to do a yearly mammogram. There may also be additional recommendations based on your specific situation, which your primary care doctor can talk to you about. You may be wondering how you can get a mammogram, particularly if you don't already have a primary care doctor that you're established with. And I'd like to turn it back over to Pebbles to talk about a special program that we have for that.
This month, we're really excited to partner with Kokonis Furniture and WHIZ to bring mammograms to our community for free. If you're someone who needs a free mammogram, please stop in to any Kokonis location or the Genesis Cancer Care Center for a voucher. Once you pick up your voucher and fill out some personal information, someone from the Cancer Center will be contacting you to go for your further steps. Help us spread the word for those that need mammograms. Thank you. All right, Dr. Gupta, we have a couple questions from the audience. What do I do if I have a nipple discharge and/or changes in my breast?
Good question. So it is very important to alert your physician right away if you notice any changes, either during those monthly self-breast exams or if at another time you were to notice any nipple discharge or skin changes. It's also important not to panic because remember, certain things can be caused not by cancer. For example, certain medications can cause nipple discharge. But we always want to evaluate it, and after you are seen by your doctor, they may recommend additional tests, such as imaging tests or biopsies if needed to help us come up with a diagnosis.
I've heard a lot about genetic testing. Should everyone have genetic testing?
That's a great question. Genetic testing has been expanding and evolving over the last several years. The most important thing is to speak with a trained genetic counselor, which we do have available here at Genesis for your convenience. In addition, the American College of Breast Surgeons does recommend that every patient with a new diagnosis of breast cancer should be offered genetic testing. There may be additional circumstances that apply to you based on your individual family history, and you should discuss that with your physician. We will ask about your family history because it is an important tool in making decisions about genetic testing, so it's important to talk with your family members and have that available when you come in to see your doctor.
I was newly diagnosed with breast cancer. How do I know my doctors are discussing my plan of care?
This is a very important question, and it's something that we take a lot of pride in here at Genesis. We have what's called the multidisciplinary cancer team, and that means that there's not just one person taking care of you, there's a whole team of us, but we want to make sure that we're all on the same page and communicating regularly about you. So we have a weekly meeting which includes a variety of physicians and nurses who may be participating in your care, and we take that dedicated time each week to discuss all of our patients and give updates to each other to make sure that we're all on the same page with you.
Another common cancer in our area is lung cancer. Dr. Gupta, can you share with us some information on lung cancer and lung health?
Yes, so lung cancer is the leading cause of cancer death in our country. So it is another very important topic that I wanted to discuss today. The first thing that I wanted to talk about is smoking cessation. Cigarette smoking is extremely detrimental to your health, not only because it increases your risk for lung cancer, but several other medical problems as well. We have dedicated smoking cessation counselors who can help you with techniques, tips, and tricks to cut down on smoking if you're interested. So please check with your doctor if you're interested in this. Another tool that we have available to help pick up lung cancers that are small or very early is called the Low Dose Lung Screening CT program. We started this program about 6 years ago, and we've actually picked up 46 cancers that probably would not have been otherwise detected until they were at a more advanced stage. So this is a program that we've been very proud of, and I wanted to show an image of a CAT scan that we did as part of this program that did pick up a very early lung cancer in one patient. So as you could see from that CAT scan, the red arrow represented where that tumor was, and in this case it was very small. It was a stage 1, which is the earliest stage, and we were able to treat that patient and cure that patient of his lung cancer. Now, what if you have a scan and we find a spot like we did on that patient? What step comes next? Well, that brings me to another exciting new technology that we have available at Genesis called Monarch. And I want you to hear a little bit from one of our colleagues in the pulmonary or lung department, Dr. Adamo. He's going to talk to you about an exciting new tool that they have to help us biopsy those spots that we may find on a scan and biopsy those that may have been too small or in a difficult location for them to biopsy before this technology was available. So let's hear from Dr. Adamo.
My name is Dr. James Adamo. I'm an MD, and I'm a fellow of the College of Chest Physicians. I am the medical director of the Pulmonary Critical Care program here at Genesis, and I'm also medical director of the CCU. Well, lung cancer is a huge problem in the United States. It is the cause of death in about 140,000 Americans every year. And about 1 in 15 Americans can expect to get lung cancer in the course of their lifetime. Unfortunately, only about 1 in 7 or less than 1 in 7 Americans will be diagnosed in the earliest stage of lung cancer. So it's important that we push back that timeline so we diagnose people earlier and try to save lives. Unfortunately, most lung cancers are diagnosed at a later stage, not the earliest stage. And that's because it's a rather silent disease in its earliest stages. It's very hidden inside the lungs and you don't have any symptoms. You don't have necessarily any cough or bringing up blood or pain. And those symptoms come on later in the course of the disease. So Unfortunately, the majority are diagnosed later and the prognosis isn't good. The 5-year survival is about 19% for all lung cancers. So we already do bronchoscopy. Bronchoscopy's been around for many, many years, dating back to the early 70s, and it's evolved. And so we've gotten better and better at navigating out to smaller nodules towards the periphery of the lung. Monarch is a real game changer in terms of how well we can do that, because we can navigate out further into the lung towards the periphery of the lung, the very edge of the lung, and get to smaller and smaller nodules down to about 1 centimeter, which is less than a half an inch. So the Monarch system, the Monarch platform, really is a robotic bronchoscopy system to get us out to where we need to be. It can navigate out to the nodule, and then we can use all the usual tools that we use right now to biopsy that specimen. That includes tiny little needles, hollow needles that can get into the tumor. It involves brushes and biopsy forceps, for example. The robotic bronchoscopy is controlled with a game type controller so that you are in a more relaxed position and allows you more precise control of the instrument. Any patient with a lung nodule or a lung mass that we want to diagnose, of course you have to screen them medically to make sure that they would tolerate the procedure, but most patients, even with COPD and such diseases as that, would tolerate this procedure. We do many patients with emphysema, for example. So any patient with a lung nodule or mass that we want to make a diagnosis on, and actually more patients now because even smaller nodules can be approached with this system. All the physicians that will be doing this have quite a bit of experience with bronchoscopy. I've been doing bronchoscopy for over 30 years and have done advanced bronchoscopy as well. So it's an evolution. So all of us are skilled with bronchoscopy, and this is one further iteration of that same technology. Initially, it will be myself, Dr. James Adamo, and Dr. Emily Bronner. We are going to be the first ones to use the technology here at Genesis Hospital in Zanesville. And my background is I've been a pulmonologist in practice since 1989. I trained at the Cleveland Clinic, and I've been doing standard bronchoscopy and advanced bronchoscopy for many years. Dr. Emily Bronner, one of the other physicians that will be initially doing this procedure here at Genesis, is also a pulmonologist. She's board certified in pulmonary critical care medicine as well as internal medicine. And she trained at the Ohio State University Medical Center in Columbus. The Monarch platform is a new technology. It's only been out for a few years, and we will be one of the first 3 in Ohio to have the technology.
All right, and so we're back to some questions from our audience, Dr. Gupta. I've been smoking for a long time. Does it matter if I quit now?
Yes, it is very important to stop smoking at any time, even if it has already caused a medical problem such as cancer or something else. The reason is that continuing to smoke can lead to other medical problems, which can only cause further problems over time. It can also, if you've already been diagnosed with cancer, it can increase the risk that your cancer would come back, that you would develop a new cancer, or that the treatment that we gave you wouldn't be effective. In addition, you are also exposing potentially other people around you to continued secondhand smoke exposure if you continue to smoke, and that can lead to problems in your loved ones.
How do I know if I need a low-dose lung CT scan?
Good question. So the recommendations are actually being updated for this right now. There's a draft recommendation currently in place and it's awaiting final approval. But with those guidelines, they would recommend any adult age 50 to 80 who has a 20-year pack year smoking history, that means the equivalent of 1 pack per day for 20 years, and who currently smokes or has smoked within the last 15 years.
What if my biopsy is positive?
That's a great question. So that obviously can create a lot of fear and anxiety, and I want to assure you that we have a great team to help you through the process. And this includes a multidisciplinary team, which would include your nurses, your surgeon, your radiation oncologist, your medical oncologists, the radiologists who look at your scans, the pathologists who analyze your biopsy specimens. And again, we meet and discuss every patient's case so that we can come up with the best customized treatment plan for you and make sure that we're coordinating our care among the different physicians that you may see.
Thank you very much, Dr. Gupta. When it comes to cancer, the Genesis Cancer Care Center team fights with you in prevention, diagnosis, and treatment. If you would like to find out more information about lung cancer screenings, call us at 740-450-6246 or visit us on the web at www.genesishcs.org. Next, we have a martial arts demonstration from Dale Houston of the Martial Arts School of Ki.
Hello everybody, I'm Dale Houston. I own this school, Martial Arts School of Ki. It's the discipline I teach is called Kashido Aikijitsu. It's a cross between Aikido, which is wrist lock techniques, and Jiu-Jitsu, and Chinese Kempo for the striking. So what we're going to talk about today is how to defend yourself against a would-be attacker. There's going to be several steps. Like the first one I want to go over is knowing your environment. It's called situational awareness. Is know your environment. Don't put yourself in a place where there would be like cracks and crevices walking down the alley. Listen to your gut, because God gave you that gut instinct. So if it tells you it's wrong to go down there, more than likely it is wrong to go down there. Interviewed several people who've been attacked, and the first thing they say is, I had a gut instinct, a gut feeling I shouldn't go down that way, and I refused it and went down there anyhow, and I got attacked. So that's one. So posturing is very important because more than likely, might as well face it, more than likely, if you are going to be singled out, they have watched your patterns, watched what you did day after day, maybe weeks, maybe a couple of months. They study your patterns. If you have a normal routine of doing things, and we are creatures of habit, and we have routines. So if you park in the same spot, go to the same coffee shop, you get your coffee before you go to work, park in the same spot at work, walk the same path into your office, to your business location, they study that. If you have another one is where, same with home. They usually know your patterns. And another thing you want to consider is when they select you as the victim, as the person they're going to attack, they view you as the weaker person, more than likely. So they view you as the weaker person. That's why I'm going to talk a little bit about the posturing. You just want to it's called fake it until you make it. So you just walk tall, walk like you're not scared, not challenging. You just walk with your head up, constantly not looking, real hard, but just knowing your environment. If you're walking down a sidewalk and you're coming up in a dark crevice or an alley, walk to the edge, closer to the road, and away from the crack where someone can grab you and drag you in. Two is how you posture with your chin up, head up, walk confident. A lot of this will increase not being attacked severely. I can say 90%, but it used to be, I have to check the numbers, but you do reduce your chances drastically in how confident you want to portray that you will be the most, you'll give them the most resistance. They want someone will not give you any resistance to comply with them, so they can take you from the public place to a private place, or just attack you right there. Okay. Two, the go a little bit more detail on this. Like I said, they select you. That's usually either from abduction to just straight attack. There are a few different type of attackers. One's a thief, one's an abductor or kidnapper. Then you have what they call the blitz attacker. That one, they're just attacking you just because they're mad. It's not premeditated. They just go after you and just attack you. The abductor, again, they're going to take you from a public place to a private place. What I want to express to you is you want to stay in the public place as long as you can, give them the most resistance as you can, and make it miserable for them, because the longer you stay in a public place, the more likely of surviving the attack. And the third one is a thief. Thief wants speed. He just wants your purse, your money, your car keys. Give it to him. I mean, that's why you carry insurance. It's better to be out $500 than be dead. And that's, that's what you got to take in consideration. Don't hold anything of value in your purse. What I mean value is sentimental value. Pictures of your mom who may have passed away a few years ago. It might be nice to have that you look at, but if it has a lot of sentimental value to you and you can't separate with it, you probably shouldn't keep it in your purse, because if there's nothing of sentimental value, it's nothing to let them take your purse. You could always call your credit card company, cancel all your credit cards, as long as you stay alive. Okay, to move forward a little bit. What we're going to talk is, what if you do get selected, you are the victim, they are going to single you out and they're going to attack you, you want to defend yourself. There's a couple of ways. You've got to recognize who the attacker is. Okay, you got to recognize who the attacker is, and you got to assess quickly how to deal with it. Like a blitz attacker. Another thing about blitz attacker, there is some premeditation on some of it, like an active shooter. Okay, they're not specifically coming to kill you. They just want to do mass destruction. So the thing is, when you walk, okay, you want to look around, keep your chin up, maybe pinch your shoulders a little bit. You don't want to walk threatening, but you want to walk more just confident. So if you look down, and as we're walking by, and you look down in the way as I walk by, that's a sign of weakness. She has, by gesturing, she has showed that she is submitting to me. And that's what I'm looking for if I'm going to select somebody to attack. I want someone that's going to give me the least resistance so I can dominate, because most attacks, they want power. They want to feel strong, because everything in their life is not going well for them, so they want to dominate someone else. Okay, so if you do get grabbed, we'll do the abductor first. If I want to take and try to kidnap you, take you from point A to point B, or to public place to a private place, you want to resist. First, you can try pulling away as I tug. You tug back, and just a constant pull. But again, I can still overpower. Go ahead and do it hard. Don't let me pull you. Where? Again, doesn't matter. If I'm strong, and if I am abducting you or attacking you, I have deemed you weaker than me. In my mind, I've deemed you weaker than me, and something about you has showed that that you will submit to me. So that might be because you walk with your heads down, your shoulders are curled in, and you just walk with lack of confidence. Okay? So when I grab, you might tug a little bit, and as I pull harder, you might just take a lunge at me and push me on my butt. So if I'm pulling hard, okay, because I am trying to pull her. She's resisting a little bit. She's resisting a little bit, or a lot, and then she just changed direction, and I can't compensate fast enough. I'll land on my butt, and then she can run the other way. Two is if I pull, I call hugging, and she comes in and hugs. And again, attacker's not expecting this. They're expecting the total resistance pulling away. So if I go try to pick her up, she just sets right down and latches on. Now I can't take her anywhere. How many of you have children who sits on your feet, and you're sitting there walking around with moon boots on because your kids are sitting on your feet? They think it's fun, but it's really hard to walk. Think you have a full-size woman sitting on your foot. Go sit down. So once you're down here, cross your legs really hard, tight. It's something you want to also be aware of. Self-defense is not injury-free activity. You probably will get hurt. You'll get hit. So even if I punch like this here, she's going to punch her. I come here like this, she's going to move. Now, while you're down here, what you could do is you can punch the groin and just keep punching until he's going like this. Remember, you want to give the most resistant possible. You want to make it miserable for him, okay? And also you can be biting and screaming the whole time. Bite, take big chunks of flesh out of my leg, punching upward, it's going to make it miserable for me. And get to the point where I'm sitting here, I can't get away from her. See, I can't, she's screaming, it's hard for me to move. Or she can take, if she doesn't grab a hold of me, if there's a light meter, or a parking meter, telephone pole, she can hug onto the telephone pole and do the same thing. Again, you want to hide your face and everything, and then like punch up, and it's going to, eventually the guy's going to tuck her out, and it's going to be hard. And then if he does knock you out, now he's got to deal with trying to pick you up. After he has struggled with you for about 5-10 minutes, he's going to be exhausted, okay? Because now I was trying to take her, now I can't get away from her fast enough, so you can let it go now, okay? Even if I pick you up, if she's walking and I grab and pick her up from behind, again, you got to keep in mind, this is not an injury-free activity. You probably will get injured. But if I pick her up, what you can do is just lean forward and grab my legs from underneath. So if I take and pick her up like this, she leans forward and grabs my legs here. And then she starts biting my calf, and it becomes miserable for me. And I might drop her, and then she can just wrap my leg, and now I'm in the same situation. If I come here, she just rolls over, and she's got control of me. Prize fighters, when they start getting tired, boxing, what do? They hug each other. Why do they hug each other? So they won't get hit hard. It's known when they say they punch like this because you can't get hardly any power in your punch. So if I come and I start swinging at her here, she holds on to me. Again, she can drop down, she can bite me in the chest, she can scream in my ear, she can bite my ear, or whatever. This is a little bit of defense. Again, I start punching her this way here, and then she starts biting. And then once she starts biting, I start freaking out because it hurts. Okay? Now, if she tries to get away and she trips and falls, what you want to do, you fall and trip on your back, lay on your back. What you do not want to do is you do not want your attacker to set down on your hips. That's where all your power is. Now, this is not an end all, but it makes it a lot harder for you to get out of this position. What you want to do is as I'm attacking, you want to spread your legs. This sounds completely different what you think you should be doing. Everybody wants to cross their legs and protect themselves. If you watch MMA fighting, Jiu-Jitsu, it's called their Gracie Guard, as the guard position. So as I come here, she spreads and wraps, okay? And then, so if I go to punch, she's gonna lean up and grab my neck and just pull me right down. Okay, now it's a lot harder for me because now she's on me hard. I can drop on her and she's hinging, and hinging makes it hard because then she's not using very low strength. There you go. Very low strength because you're relying on your elbow and very little strength. I am struggling like crazy. She's not doing anything. She's just hanging on there. She's squeezing. At the same time, she's screaming and yelling. So again, she falls down. I come after her. She falls down. She automatically wraps. So I'm sitting here like this. I'm trying to hit her, and she's just pulling tight, and then she locks in tight. Again, I can punch her here, and then she starts screaming here. Punch, and then this really becomes hard because now I'm dealing with her weight and my weight at the same time. And I work out constantly, but it wears you out. So those are some small things. Just going to wrap it up. Those are some small things. It's not an end all, but it does buy time. This, more likely, this whole attack on the ground stuff, all you're doing is you're controlling your attacker. And as you can tell by me being winded just a short period of time, my heart is beating like crazy right now. It just, you're buying time, hoping your attacker wears out. And then you're screaming and hollering. And then one more thing, when you're on the ground, when you're doing all this, maybe take your finger, scratch the eyeballs. If you can't see, he can't chase you. And that's it. So hopefully this will help you, give you a little bit more, more insight on how to portray yourself for an attack. And stand tall, walk proud, and walk healthy. Thank you.
That was great. A big thank you to Dale Houston and the Martial Arts School of Ki. I also would like to thank Dr. Gupta, Dr. Adamo, and Pebbles for sharing their time and great information with our Spirit members and viewers. If you have not already added your names to the comment section below, please do so. We'll also continue to take names for 5 more minutes after our live broadcast. Thank you for joining us for our Genesis Spirit of Women program, and watch for more Genesis Spirit of Women programs coming soon.